do people from the Netherlands live abroad in New York? How do they live and work in the city that never sleeps? That's the question to which this Club NYC podcast will give you the answers.
And welcome everybody to the next episode of the NL Club podcast. And last episode we were talking about healthcare, because the thing is that healthcare is such a big topic. We're going to do another episode, which we normally never do. But these guests today have so much to tell us and so much to share that we really wanted to have a next episode with them. So today we're going to even deepen and go even further into U.S. healthcare. And for the people that missed the last episode, let's do a short introduction. And can I start with you, please?
Sure, no problem. My name is Chantal Deen, and I work at Home Insurance in the Netherlands. And we provide private health insurance for Dutch people traveling, working, studying, or enjoying their pension abroad.
Awesome. That's so cool. And for how long have you been doing that?
I've been doing that for almost 16 years.
So you've seen a lot.
Yes.
So cool to see. Thank you for being here today. Jaap.
My name is Jaap Boelens. I'm a pediatric oncologist. I'm working at Memorial Sloan Kettering Cancer Center here in New York City, Upper East Side. I'm the chief of the cell and gene therapy service. I moved to the US about 7 years ago with my wife, who is also in healthcare. She works as a physician at Memorial as well, and 3 girls. And I did most of my medical training, PhD, in the Netherlands.
And where in the Netherlands was that?
That was in Utrecht. I did my PhD in Amsterdam, University of Amsterdam. I did my residency pediatrics in Leiden. And my oncology in Rotterdam.
So you've been around.
Around.
In the most beautiful cities in the Netherlands.
The Hague. I was in The Hague as well.
Okay. Marthe, please.
Yep, thanks Mark. Marthe Haverkamp of Marthe in the Netherlands. I've seen a lot of areas in healthcare. I started as an infectious disease physician, then did basic science. I did a PhD in immunogenetics. Also did healthcare policy for the RVZ and for at the Harvard School of Public Health for the Commonwealth Fund. And now I'm a healthcare consultant working for large hospital systems and physician groups at Alvarez & Marsal. I'm excited to be here again.
Yeah, very impressive. And just to, as you were the last, and you can maybe answer the next question first, is if you would have tips to people that come to the US, and maybe you can just name 2, what would be the 2 tips? And then I will go to you guys that you say, if you go to the US, do this and do this.
I think if you are already in the US, I think for me the biggest tip or the biggest lesson has been the insurer is your friend. So don't do anything, and I think we touched upon that in the last podcast too. Don't do anything before you have talked to your insurance about in and out of network, about what the costs are predicted to be. So that's one. And then the second one, I think, is do not pay healthcare upfront. Often, healthcare providers will try. For example, my husband had a planned kidney stone extraction, and you have to be there at 5 a.m. And then they ask you to pay in advance.
Yeah.
And happily, he didn't have his card. Otherwise, he would have paid, I'm sure. But of course, you have to always wait until you get the itemized invoice. So you can see sometimes there's weird things. My son at some point, there was earwax taken out for $250. And then you call your provider and say, hey, wait a minute.
Clear in the beginning. That's the most important thing. Yeah. Jaap, for you, the 2 things that stand out, if you either you are already in the US working, or for love here, or you're planning to come to the US, what are the 2 things you need to have on your radar?
So I think it's important because the healthcare cost can be pretty high. To make sure you have a health savings account. Because let's say deductibles can be between 5,000 and 8,000 a year for the whole family, and there is also a copay. So if something happens, let's say January 1st or 2nd, you may have to pay 4,000 or 5,000 out of pocket. So it's better to have a health savings account. You will get a credit card or a debit card, and you can use that for
And maybe you have to
healthcare.
explain, right? So you have two kinds. You have the HSA, the health savings account, and you have the HRA. And the health savings account is like a bank account where you can pay anything that is healthcare related. And you are the one deciding if you think it's healthcare related enough to use that card, because it's pre-tax, of course. You and your employer put money in it, and you have to save all the bills for the IRS because they can come and check later on over the years. HRA is a different, and you keep that account. The HRA is different. That account is only paid by your employer, but will expire at the end of the year. So anything you don't use, you lose. And you can pay yourself. You pay yourself your stuff, and then the employer reimburses you. So that means, and in the beginning you have to choose. And then they ask you want an HSA, you want an ARA.
No, I think you can do both. I think you can
Really?
do both. So
I didn't know.
As MSK, I can do both.
I had no clue.
So the health savings account, and I would really recommend to do the max each year.
Yeah, for sure.
Because it's pre-tax dollars.
And you use it.
And you use it easily. And so and if you don't use it, you can take it to the next year. The second one is the flexible spending account, but that expires by. So if you don't use $2,000, you will lose your $2,000. It's also pre-tax dollars.
Got it. Okay, that's a good one.
So I like the other one better than the flexible spending account.
Yeah.
And often
But
indeed
if
you
you know-
forget to use it in the beginning, because we're as Dutch people are not used to doing this.
No, not
And
at
then you
all.
think, oh my God, I should have.
Yeah.
And then you, looking from the Netherlands, people that come here, what would be like your advice, your one or two advices, like either before they go or when they are here, just go to Oom Verzekering, call
Yes.
us. Yes.
Call us. And you don't need those accounts. And the premiums aren't that bad, but I think that it depends on whether you're a partner or you're working for a company, and you will get an insurance that is, provided by your employer. But so the best tip is just come prepared. Just think, am I going to move there forever? Am I just going to stay there for a few months? Think about that, because it's not as natural as it is that you think you can travel on. We've discussed that in the previous podcast as well. It's not that natural that you can take out your Dutch insurance outside of the Netherlands into the US.
Yeah. You need to get rid of that thinking. And one of
But
the
that's difficult.
That's difficult because
is.
that's like what you used to do.
Exactly.
That's what you think is normal, and when it's normal for your country, it's normal for the whole world, but it's not.
No, it doesn't work like that.
And one of the things that I learned from you guys was that you also need to shop around. Is that correct? Can you
Yes.
tell us a little bit about why should I shop around and for what?
I think that from a Dutch perspective, when we started the health insurance, we looked at the Dutch health system, and we know the Dutch like to go to a physiotherapist. We love that, and we want to have 25 visits per year. But that's madness. When you're here, it doesn't work like that. It's different. Here, you will get the full body scan, and we were like, what? The full body scan in the Netherlands? You would say that's not necessary. But I think that just look at the country where you're going to. How does the system work over there? What is common and what's not?
Okay, and if you look at it, Jaap-Jan, from your perspective, like the thing is,
Yeah, the shopping around. So I think we have to realize that here in the US, the quality of care is huge. So you can have very good care
difference
and
in quality.
very bad care, and even within the city. So there's a huge gap between the best hospitals and the lower performing hospitals. And I think that's different in the Netherlands, because I think in the Netherlands all the hospitals are pretty good.
But how do people know?
I think they...
How do you know when it's not
I
good?
think that also, let's say, complicates, because it depends on the insurance whether the higher end hospitals are in network. And for some of the lower insurance, they are not in network, and some of the people can't go to MSK, for instance, where I work.
So it's very important that you take in consideration that if you are paying lower, like the Dutch basic insurance, you can choose for low, but then not everything is covered, but you can still have access to, like, say, good hospitals. But the thing here is, like, the higher your monthly rate, probably if you do your research right, you will have access to better hospitals with a better standing.
And so I think it's good you can shop, but there's also a downside, because here in the US, unlike, let's say, the Netherlands, most of the care is standardized. Whether you go to Groningen or to Amsterdam, because there's, for instance, in the case of, let's say, oncology, there's a, let's say, national network. So you will get likely the same care in Groningen as in Amsterdam. But here, there's a lot of opinions. So if you go to 4 different doctors, to 4 different hospitals, you may end up with 4 different treatment recommendations. So that's not always helpful.
And I also think that shopping presumes you have a choice. Of course, here in New York, I look at how many doctors must live here and how many hospitals. But in a rural setting, one of the complications, I think, of the U.S. healthcare system is that everyone accepts that government pays on Medicare, Medicaid, pays relatively low fees. Then providers count on the commercial health plans to fill the gap, so pay more. And that means that some providers, specifically in the behavioral health area, they will refuse you when you are Medicaid only. So for Medicaid patients, it's often very difficult to find care. Not in New York, like we said in the last podcast.
Yeah. And then, for example, because it makes me think, like, I meet a lot of, like, NL Club members that are, like, young, like, they're, like, 25, they're beginning of the 30s, like, the next step in the career is here, and they're thinking about, like, okay, I'm gonna be doing my career here, but also I have the age to become, like, pregnant, or I wanna, like, have a baby. One of you guys haven't... Is there a difference between, when you need help to get pregnant, because not everybody gets pregnant that easily? Is there differences between the systems in the Netherlands and here in the US for getting IVF or something of that kind?
I've never done it here. I know in the Netherlands it's 3 times, I think, is covered.
Yeah, but you have, like, a waiting time of a year, I think. Is it? You have to try for a year, and then if it's not working...
I don't think here's a limit. It's just you have to pay a lot.
You have to pay a lot. I think in some of the plans it's a couple times, but in some of the plans it's not covered. And I can give you an example because I'm in, let's say, cancer care. So fertility is a thing that always comes up. Because do we need to do fertility preservation? And in my service we gave really advanced, high-end, super expensive therapies, sometimes in the millions. Interestingly, some of these plans pay these very high-end, sophisticated, advanced therapies, but they do not pay for fertility preservation, which is only $1,000. And some of these families, $1,000 is still a lot of money. So we try to organize that with funds and charity things, but I think that nicely illustrates how weird the healthcare system is.
It does.
Let's say paying for 2.5 million therapy, but not willing, even with appeals and peer-to-peers, etc., to pay for 1,000 bucks fertility preservation.
So that makes me think that there are some treatments that are more accessible in the US and some that are less in the Netherlands. Is there a comparison as well?
Or it's their, let's say, mindset. So maybe these, let's say, payers think, yeah, that's your problem. I think that's a thing you should pay for yourself. And you should have saved money to make sure you can do the fertility preservation. I think there must be something like it, because 1,000 bucks extra.
Well, in the Netherlands, we're like, that's my right to get that as well.
Yeah.
And I think it will happen as well. So
Yeah. So it's an important, it's an important decision, but also an important difference, right? That every healthcare system, every governmental system, non-governmental system has a different way of looking at things and paying for things and thinking that it is righteously or not righteously adding to health or the life pattern that you want.
And if I can weigh in on that, is that things change. I mean, now that's quite normal that you get, when you're a young adult. And so saving your eggs is like the smart thing to do, right? People going into transition. And I think the healthcare, if I can only talk for the Netherlands, is not really, it's not as equipped for it as we should be. So we just running after the facts the whole time.
Yeah.
I think that is a problem as well.
Yeah. And then when you look at it from disparities in care quality, so if you look at the disparities in that, Jaap-Jan, how do you, can you share your thoughts about that a little bit?
So I think with regards to the disparities, I think that also falls back on social status and economics. I think for the hospital systems, if you have a good insurance, it really, it doesn't matter whether whether you're black, white, Asian, whatever. But having access to these super advanced therapies is an issue. And I think New York State is really advanced compared to most of the other states, because New York State would like to give equal access. So I can get, for instance, therapies insured for sickle cell patients. That's not cancer, but we also treat sickle cell with gene therapy and stem cell transplants. And that's an underdeserved, group that's mainly black and, Hispanics.
And I think, so we already spoke last time about the differences in life expectancy. If you take perinatal morbidity, for example, so women dying in childbirth, around childbirth, and in the US that's 22 per 100,000 birth. In the Netherlands it's only 3. But if you look specifically at the black population, and I'm not 100% sure, but I don't think it matters whether you're rich or poor. But for the black women, there's 50 women who die per 100,000.
Yeah, it's way higher. I heard that last week.
So, so disparities are really a big. And I think if we talked last podcast also about health outcomes in the US in general, and what struck me always is how the worst outcomes are often concentrated in the southern states, or in the states with more conservative, led by the conservatives on the political spectrum. If you talk about diabetes or obesity or perinatal morbidity, of course, a number of people uninsured. And I think sometimes there's this old concept in the US that's about the deserving and the undeserving poor. And sometimes that still sort of works here, where if you're poor and sick, of course, you need help. But if you're just poor, well, then you have to prove that you're worth the help. Mm-hmm. That's the idea from before. But I think it still works in Republican politicians who propose work requirements for Medicaid, or to be able for people to get Medicaid. And it also works for Democratic politicians who have to pragmatically work with this concept and pull in a lot of social services into the healthcare budget, like food and transportation and housing. That blows up the healthcare budget. It's now 20% of the US economy. It makes the US, the healthcare budget, really difficult to manage.
So it's really important that what they are pulling into healthcare, what is in there, what is not, is as an important effect on total healthcare costs. What I also found super interesting, and when we talk a little bit about technology, Jaap, you also run a lab, and I think I heard you say in the last podcast that one of the benefits is that you can actually, as a doctor, innovate and implement and test real time instead of being regulated and being approved before you can implement, right?
It's still, let's say, regulated, but it's more hospital regulated and not state regulated. So in, let's say, the Netherlands, I have to go to the CCMO in The Hague to get an advanced therapy into a clinical trial. There's a board of a handful of people, and most of them, but maybe I can say it here, they have no clue what you are talking about. And they really can frustrate for years to get an advanced therapy into a clinical trial. Here, the, let's say, turnaround time is much faster. Within half a year, I can have an advanced therapy into a, let's say, clinical trial. The FDA also has to check it, but it's much faster, and it's easier regulations than in, let's say, Europe.
Yeah.
And clinical trials.
And easier to get money to run these clinical trials, because the funding in, let's say, the Netherlands from the States is really tough, and it's really not enough. So you really need extra funds from for instance, philanthropy or charity to fund a clinical trial. But here it's much easier to get it.
Talking about disparities, they're often seen as a way for the lower socioeconomic patient groups to have access to
it, yeah.
Which in the Netherlands we would see as unethical, because it means you're sort of forced in a setting that's a trial setting that's not evidence-based yet.
Yeah.
But here in the US, it's something they have to allow or have to work with.
If you look from your perspective and the differences between the US and what we're just talking about in the Netherlands, what do you see from an insurance perspective that people should take into consideration? Is there aspects where you say, like, okay, when you go to the US, or when you're gonna emigrate to there, or when you are going to live there, it's important to, do you have any like additions from Ooms-verzekering?
Okay, I think, well, I said it in the last episode as well, is just inform yourself before you leave for the US. I mean, just dive into it. There are many comparison sites and even like brokers that can help you. And where are you going? And you talked about it before. There are just like states where it's fine. We have a lot of customers. I'm saying a lot, but we have some customers in like Denver, Colorado, and the costs there are just through the roof, and there's no possibility to going into network. So just prepare yourself. It doesn't work the same as in the Netherlands. Just leave it all behind. Forget about it.
You're going to new country,
yes,
new rules,
exactly,
new systems,
yes,
new ways of looking at
yes,
things.
And don't accept everything.
Okay, that's also a good thing.
Just
you
negotiate. I would say out of it.
Yeah, and if you look at people that are going to it's going to be part of this club. They're going to be living here. Is it always a good thing to start to check Ooms insurance and have a conversation on that? How would that work?
Why not? It's always a good idea.
Do I like talk to you? How does that work?
You can talk to me.
You can talk to you?
Yes, we are.
Or do I fill out a form? Like, how does it work with you guys in general?
We're a very small company. We're a niche company, as you would say.
Yeah.
So we have about 50 employers, where I'm one of them. And so you can phone us, you can email us, and you could go online and just take out a quota, just see what it will cost. But if you need to, be navigated around, you can contact us and you can contact me.
Yeah.
No worries.
That's super cool. And then if you would say like, do you guys compare yourself with anyone in the Netherlands, or are you guys uncomparable and just the best?
I wouldn't say that. We're not uncomparable, but I think that we don't, it's not like one size fits all. It doesn't work like that. You have in the Netherlands, you have the Goudse, and their proposition is more on the expat, and we think that there's more target groups that we can, offer an insurance for. And what they do is when you're 60 plus, you can apply for an insurance, and when you're 70, 72, they're going to let you go. So we're not doing that. So there's the difference.
Yeah.
And on the other hand, we do have a great proposition. Our USP is that we pay what it will cost. How cool is that?
That's really cool, because my insurance will not do that.
I know. We have no co-payment.
Yeah.
We have I just said it in the last podcast. We have the highest deductible is €1,000. And I hope that we can keep on doing that.
There's no limit, so if you live here for 20 years, you can still have home?
Exactly.
That's really cool.
Until I always say, until death do us part.
Wow.
Yes.
I can't do
So,
this,
and the
but I can say,
premiums
wow.
are how high?
Oh, that depends on your age. Unlike in the Netherlands, where we all pay the same basic premium, we just look at you. How young are you? And so you pay a lower premium.
So when you're in the 50s?
Yeah, I cannot say that.
But no pre-existing conditions.
Exactly. That is a very important issue.
No.
Okay. We do ask you a couple of medical questions, yes, because we would go bankrupt right away, I think. No. So we have to ask you a couple of medical questions, and it depends on how long you will be staying here. So I just spoke to somebody here. He's like, I'm just going to see if, it's going to work out. We also offer like a temporary insurance, and we will look at it differently. We have like medical advisors. I'm not medically, equipped to say something about that. So that just depends. But if you're like healthy, then it's no problem. And we're not gonna kick you out of the insurance because you claim a lot.
Okay.
It doesn't work like that.
That's beautiful. That's really nice. Because
We have clients here in the US that are with us longer than 25 years.
Oh, wow.
Wow, that's really cool. Because the thing was this: I had a medical issue back in May, and then the funny thing was that I steered everything over my Dutch basic zorgverzekering, and then I had an extended one, which was the American, where I found out that they only pay the medical care based on Dutch costs, so they don't really care about your bill was here like this. And the funny thing was, I also have American Express, and they have a health insurance. So what they basically did was they covered for the rest, and they were easier than my health insurance, my basic and my travel insurance all together. So they
Because
were
you pay to bill with the American Express. Because you have to.
I didn't.
No?
No, I didn't. No, I just put all together of all of my costs, and it was travel insurance. So it was very interesting that I could compensate the part, because now I'm gonna become part of OMS, right? But the thing was that, of course, I'm gonna sign the paper because you convinced me. But the thing was, it was very interesting that we were talking about shopping doctors, but shopping insurances, and then having your basic plus your travel not really covering everything, and then you go to your American Express,
and then presto,
and they just made more of a refund. It's really interesting.
I think that's all got to do with you're going to pay for it. That's it.
Yeah.
They have the guarantee of payment.
Yeah. But I also think that if you are willing to put in the price, so also to you guys' point, if you're willing to take a little bit higher monthly pay to your insurance, either if it's OMS or if it's here when you were in New York, living here as well, you will get the benefits of it. And don't be penny wise, pound foolish. Don't be Dutch cheap. We're still Dutch, but take the average between extreme the one and I think, right? Is that correct, Mark?
Yeah, I'm wondering if here there's a relationship with how high the monthly premium is. It's more, the difference is more, do you have a high deductible plan or not a high deductible plan?
It's the coverage.
And then indeed it's
The
a network
networks.
of the insurance. I'm not sure if there's a link, as you
Okay.
said.
And
Yeah.
I think, I don't know which one of you mentioned it before, but it's the pregnancy. A lot of young people, you said that in the last podcast, that so they come here and they will get pregnant. That is an interesting coverage.
Yeah.
I mean, that's good to think about it before you leave the Netherlands, to make sure that you have coverage and you don't have a waiting period, because, and correct me if I'm wrong, that in the US it's quite normal to do a cesarean, and we're Dutch women, we're like, no, we're not going to do that. So just think about it before you leave,
I think-
because for a lot of insurances, as we have specific coverages as well, there's a waiting period.
Yeah, and
Because-
it can be very annoying if you want to have kids, right?
Exactly, because you will insure the things that you're not expecting.
Exactly. So thank you guys. I think it sums it up amazingly. I am very impressed by the three of you and the things that you shared with us and with me in the last podcast and in today's podcast. I want to thank you for being here, for sharing, for having sharing your thoughts and your knowledge. And we're going to make a beautiful podcast out of this. And I hope one day when you guys are back, you want to come back with the latest things about, hospitals and insurances from the Netherlands. And I'm really looking forward to that. So thank you so much for being here.
Thanks for guiding this. It was very fun today.
Yeah, and
Thanks, Mark,
this is
for having us here.
Yeah, it was awesome. And this was the last podcast on healthcare for now. We're going to go and have the Friday afternoon, the vrijdagmiddagborrel on the Thursday evening, which is more practical for New York people that are very, very busy. It's the last one of the year. And I want to thank you guys all. Also the production team. I want to thank everybody that has been helping behind the scenes, because it's not only me, it's not only the guests, it's like a lot of people that are helping. And looking forward to see you guys in the next episode. And thanks so much again.